I call this meeting to order. So welcome everyone to meeting number 33 of the House of Commons Standing Committee on Health. The committee is meeting today to study the main estimates 2021 to 2022, votes 1 and 5 under Canadian Food Inspection Agency, votes 1 and 5 under Canadian Institutes of Health Research, votes 1, 5, and 10 under Department of Health, vote 1 under Patented Medicine Price Review Board, and votes 1, 5, and 10 under Public Health Agency of Canada. So I'd like to welcome our witnesses. Today, we have the Honourable Patty Hajdu, Minister of Health, and appearing with the Minister, we have with the Canadian Food Inspection Agency, we have Dr. Siddiqa Mitani, President. With the Canadian Institutes of Health Research, we have Dr. Michael Strong, President. With the Department of Health, we have Dr. Stephen Lucas, Deputy Minister. And with the Public Health Agency of Canada, we will have Dr. Theresa Tam, Chief Public Health Officer, and we have Major General Danny Fortin, Vice President, Vaccine Rollout Task Force, Logistics and Operations, and of course, we have Mr. Ian Stewart, President. So I know you're all frequent flyers with us, so indeed, welcome back to all of you. And I now invite Minister Hajdu to present her statement. 10 minutes, please.
Well, thank you very much, Mr. Chair, for the invitation to return to committee. And as you mentioned, I'm joined today by officials from Health Canada, the Public Health Agency of Canada, CFIA, and CIHR to update you on the main estimates for the health portfolio. Now, we know that as we continue to respond to COVID-19, some areas in Canada have seen an increase in cases. Some areas in Canada have had to apply additional public health measures, and some areas in Canada have seen increased hospitalizations. And so we remain focused on one goal, and that's to help Canadians through COVID-19, to help provinces and territories reduce transmission in community, to decrease the number of people getting sick, and of course, the number of people ending up in hospitalization and sadly passing away as a result of COVID-19. And we know that that is a lot of work on behalf of all levels of government, and indeed not just government, but community organizations, unions, employers, indeed everyone working together in a Team Canada approach, because the most important thing to remain focused on now is to reduce community transmission and to increase access to vaccination, to make sure that we stay focused on increasing vaccine uptake, that the vaccines are available to people in a variety of different ways so that people can access vaccines when it's their turn. And I have to say, we've been so impressed by Canadians and their desire to be vaccinated and their willingness to step up when it is indeed their turn. And as we can see, as more vaccines have been arriving week over week into Canada, we are now a leading G20 country, the second in the G20 in terms of administration of the first dose. And that's good news, Mr. Speaker, because indeed we know that vaccination saves lives and reduces the spread in communities, along with the other things that we know all too well. So in terms of actual hard numbers, what that means is nearly 13 million doses of COVID-19 vaccines have been administered. And good news, and it's reflected in case rates and death rates, 80% of those aged 70 to 79 and 86% of those aged 80 have received vaccination. And I can tell you that there is a sense of relief, especially amongst those ages who have felt so worried and so scared. And of course, the people that love them, that they are protected as provinces and territories work together to reduce transmission in community. And of course, as all of you will know here today in HESA, our approach here in Canada is focused on a population health approach to vaccination. What does that mean? It means using vaccination as a powerful tool to reduce cases in communities and to stop people from getting sick and dying. Two overarching goals: stop the spread and save lives. And of course, because of this strategy, more Canadians are protected than they were a month ago. And we are looking forward to a very busy month of May with millions of doses arriving in the country this month alone. that will go directly into arms through the strong partnership with provinces, territories, and, as I mentioned, local public health officials and other really important partners like pharmacists and family physicians. And while vaccination programs are scaling up, we have to continue to be cautious and vigilant about following local public health guidance. And that does mean the things that we know actually help prevent the spread of the virus. That means the physical distancing that we've learned, the wearing masks in especially crowded settings, indoor settings, being mindful of how and where people gather, really thinking of each other during this time and pulling together as Canadians have been to make sure that the entire community remains safe. If there's something I've learned, Mr. Speaker, or been reminded of, I think is probably more appropriate, it's just the importance of collective action to actually fight a virus like this. That we cannot do this alone, that communities can't do this alone, that people can't do this alone, but that together we can actually get a lot further. So today we will share the health portfolio spending plans for the months ahead. And as you know, Budget 2021 proposes significant investments towards a number of health priorities, from increasing research and biomanufacturing to improving long-term care and continue our investments, significant investments, I would say, in mental health and substance use supports. These investments will help us finish the fight against COVID-19, and they will help Canadians in a healthier, more equitable way to see a healthier future in their communities. And keeping Canadians' health and safety continues to be my priority, indeed all of our agency's priorities in the month to come. The main estimates I'm presenting today reflect this, and they outline the work that we are doing to achieve these goals. Over the next year, Health Canada will work with the provinces and territories to help improve health systems for all Canadians. And this work includes measures to strengthen the healthcare sector through investments in long-term care and supportive care settings. We will also address mental health and problematic substance use through continued investment in home and community care and mental health and addiction services, including specific investments to help Canadians during COVID-19. And I want to give a particular thank you to the many organizations that work with people that are struggling with a variety of different mental health issues and a variety of different problematic substance use issues. And these community organizations and providers have been there for Canadians during this stressful time, and their work is tremendously valuable to all of us. Our world-class regulators will continue their work to get Canadians the medicines, vaccines, and the medical devices they need. And that includes creating a critical drug reserve to assist with COVID-19 treatments. For the past year, the Public Health Agency of Canada has been focused on the pandemic response, whether it's on vaccines, on research, on specific COVID-19 supports. The agency has been working day and night. All of the folks in the agency have been working day and night to protect Canadians. And this work will continue well beyond the pandemic. The safety of our food supply is also always a priority in a pandemic and, of course, beyond. And the Canadian Food Inspection Agency protects Canadians from food safety risks, supports our food supply chain, and safeguards the health and safety of people working in the food manufacturing and distribution industries. And I want to thank all of the workers at CFIA for their ongoing work, oftentimes in very challenging situations, as we know, meat packing plants where there has been significant challenge to prevent the spread of COVID. And I know that inspection agents and many other professionals have been working to make those workplaces safer and to keep food safe for Canadians. After a year of living with COVID-19, the importance of investing in health and medical research, if it wasn't evident before, it is now, Mr. Speaker. And so the Canadian Institutes of Health Research is supporting Canadian research and researchers, and our investments will make sure that they have a strong and central role in ensuring science returns to a place of prominence in government policymaking. And I am so relieved, Mr. Speaker, that our government made those investments in 2015, after a decade of attack on scientists and researchers. We made those investments in 2015, Mr. Speaker, and it turned out to be critical. And we're going to continue to strengthen Canadian research through the CIHR through the researchers community that they support to make sure that we have access to the best evidence and the best science on a range of health issues. Mr. Chair, my priority is Canadians' health and safety. As we face this wave of the virus, as we see the finish line, we know that there's more work to do, Mr. Speaker. And so the plans that I'm talking about show what we have to do, how we have to invest, and how we have to continue to pull together. I know that Canadians will get through this, but we have to work together to get through this so that we can save lives, we can stop the spread, and we can protect Canadians' health through COVID-19 and beyond. Thank you very much, Mr. Speaker, and I do look forward to your questions.
Thank you, Minister. We'll start our questions now with Ms. Rempel-Garner. Please go ahead, 6 minutes.
Thank you, Chair. To Major General Fortin, has the weekly delivery schedule been finalized with AstraZeneca?
Mr. Chair, we don't at this time have exact quantities and delivery schedule for AstraZeneca for the month of May.
Do you have a weekly delivery schedule for AstraZeneca for any subsequent months?
Mr. Chair, no, we don't.
Thank you. To Dr. Lucas, in December, the Vaccine Injury Support Program was announced. On what day will Canadians be able to apply to or access this program?
Mr. Chair, given that the public health...
Monsieur le Président, étant donné que l'Agence de santé publique est responsable de ce programme, je demande à la personne qui les représente de répondre. Le programme est conçu pour être rétroactif.
Yeah.
The interpretation is switched.
Yeah, I'm just about to deal with that. Excuse me, Doctor. We do have a bit of a problem with I've stopped your clock, Ms. Rempel-Garner. We do have a bit of a problem with the interpretation. We're hearing French on the English channel.
It should be good now.
Dr. Stewart, if you could speak a few words and see if the translation is happening correctly.
Okay, hello. Can you hear me all right? Is this coming through clearly?
It's coming through okay in English. Could you perhaps, I think that's done. We'll give it a shot. So Ms. Rempel-Garner, I will resume your clock and the witness may continue, please.
Great, thanks. So Mr. Stewart, I think, was telling us about when the Vaccine Injury Support Program would be open.
The program is retrospective to December. So before we began administering vaccines, it began to be eligible. So when people want to bring forward cases, they'll be covered for the entire period of the immunization program. Right now, the service provider is still finalizing their process and getting themselves set up and ready, but they're moving along quite quickly. So everybody has coverage.
So I noticed that the applications for a third-party administrator haven't closed on the website. Are you saying they have? And an administrator has been selected?
Yeah, that's interesting. We'll double check on why the website says it's still open. So thanks for noting that.
Thank you. And if you could provide MPs with that, that would help us with our casework as well. Thank you.
Oh, okay.
Studies are, to Dr. Lucas, studies are emerging expressing concerns related to waning immunity with extended dosing intervals, particularly related to the Pfizer vaccine. Have you given the government any advice regarding Canadians requiring 3 doses of vaccines due to an extended dosing interval?
Mr. Chair, this is an area of active research. Health Canada, through the regulatory organization, is working with the manufacturers in terms of their development of boosters. We provided guidance on the clinical development and are in touch with them in terms of potential regulatory submissions in the future.
So is it fair to say that Canadians may need 3 doses of the Pfizer vaccine if they experience an extended dosing interval?
Mr. Speaker, or Mr. Chair, forgive me, as I said, the science is being undertaken on this, including assessment in Canada. We are working with the manufacturers.
Have you given the government any advice regarding the need for educating the public on risks associated with waning immunity associated with an extending dosing interval, particularly with the Pfizer vaccine?
Mr. Chair, I think I'll turn to Dr. Tam to refer to this.
Thank you for that question. And the extended dose is based on science and the advice of the National Advisory Committee on Immunization. And we're tracking the immunity related to individuals who receive.
Thank you. I was asking if any advice has been given to the government on the need to educate the public about the risks of waning immunity related to an extended dosing interval with the Pfizer vaccine.
Advice will be given to the general public and the decision makers in conjunction with the National Advisory Committee on Immunization. At this point, there is no evidence based on our data on the waning immunity. And by the way, we always advise on the second dose. That is not a question.
Thank you. Dr. Stewart, are travelers arriving at international ports of entry being asked if they've been in India, Pakistan, or Brazil within the past 14 days?
That would be being delivered by the Canadian Border Services Agency.
Fair. Have you given any advice to the CBSA to ask travelers arriving at the international ports of entry if they've been in India, Pakistan, or Brazil within the last 14 days?
Yes, I was going to go on to say two things. First of all, I'm not a doctor, and then secondly, I was going to say that. I believe they are asking that question. Yes.
And okay, thank you. Have you provided, Mr. Stewart, have you provided any advice to the government regarding requiring rapid tests at airport for all domestic airline travel?
For domestic airline travel, we have not gone into that space.
Thank you. Have you prepared any advice to the government regarding potentially stopping or reducing interprovincial flights?
We have looked at different scenarios for reducing movement,
so that would include providing advice regarding potentially stopping or reducing interprovincial flights?
In the range of things that we've considered, we certainly have thought about that topic.
Thank you. And have you flagged any concerns with the government about potential exposure to COVID-19 as travelers congregate in quarantine hotel lobbies or on transportation to the quarantine hotels?
This is something actually we look at and think about a lot, the relative risk merit of the quarantine hotels in relation to overall quarantine patterns. We believe that the operations, in fact, are being done safely. One of the things that was required to be selected as a hotel was that they show how they were going to do this safely, Minister.
Have you provided any advice about reducing the number of people considered essential travelers to limit the people who are exempted from quarantine when re-entering the country?
There's a constant and ongoing discussion about what are the categories of travelers, essential and otherwise, and that's actually a federal provincial discussion.
When do you expect any changes to that to be made, if any?
Well, it's constantly under discussion, and so it'd be hard for me to say when a decision of that nature could be taken.
Have you provided any advice about how the government could put in place measures to ensure that every person entering Canada be required to be tested upon arrival, including at land and sea borders?
Perhaps you're aware, everybody is required right now to have 3 tests, one before they arrive, one on arrival.
Including essential workers.
Oh, I'm sorry, I misheard your question. My apologies. We have done pilots, but we do not have a requirement of that nature.
Thank you, Mr. Hoggarner.
Thank you.
We'll go now to Dr. Pawlowski. Dr. Pawlowski, please go ahead, 6 minutes.
As much as I, like everyone else, has been fixated on COVID for the last year or so, I actually want to ask the minister something that is kind of related to COVID, but not totally related to COVID. And that's the issue of money for substance abuse, drug addiction, and the opioid crisis. So for those who don't know, Patty and I are the 2 members of Parliament for Thunder Bay, and I think we both share a background and a familiarity with the issue of substance abuse and the opioid crisis. I, as a longtime doctor in emergency room, saw a lot of cases of overdose over the years. There are a dime a dozen in Thunder Bay Regional Health Science Center. And Patty, I know, has worked with substance abuse programs and to set those up in Thunder Bay. So we both have a common interest in this. And I think, moreover, both of us, when at least I did, and I'm sure you had the same experience in going door to door, some of the most passionate pleas were from people that asked us to do more in terms of addressing substance abuse, addictions, and to try to decrease the number of overdoses. I certainly met at least a few people who'd lost their children to overdoses. So this is a really important issue. Now, my understanding is that in the budget, we've allocated more money to substance use and addiction programs, SUAP. Could you just tell us a little more as to how much money and where that money is going to be going? Thanks.
First of all, thank you for talking about the crisis in opioid overdose and indeed in substance use overall. And I know that you spent many years in the emergency room in Thunder Bay. And so I think that we would probably have worked with some of the same individuals, actually, who had struggled with substance use over many years. And so I am extremely proud of this government in restoring harm reduction to the Canada Drug Strategy, in restoring what I would say compassion to an approach to working with people who use substances. And of course, the work that we did through the SUAP, and I'll let Deputy Lucas speak about the specific amount of money, but the work that we've done with providing supports to communities, I think is the most critical in terms of supporting people who use substances, because the money goes directly to community-based organizations who are working on the ground, in some case integrated with the community, and know exactly how to protect community members so that they don't die, actually, so that we can save lives. And so that we can alleviate suffering. And I know, Dr. Pulowski, that you saw a lot of that in the years that you were in emergency rooms. These are folks, in many cases, at that scale of problematic substance use who are really, really suffering. They're traumatized individuals. They're oftentimes longstanding problematic substance use. And so I'm very excited that Budget 2021 continues our investment in innovative mental health projects and substance use programs that are community-based. Again, we, as you know, have a commitment to transferring billions of dollars to provinces and territories and working on mental health standards, and all of that is important. But I think that getting money to community groups that are looking at new ways of finding folks and supporting folks is really important. I'll also say it's really important to draw a distinction between the previous government's approach to substance use and ours. The previous government thought that they could criminalize their way out of this problem, that they could throw people who were struggling and suffering in jail, and that would solve the problem. And they, in fact, intentionally removed harm reduction from the Canada Drug Strategy and penalized groups that were actually working in community. As a matter of fact, I received funding when not me personally, but the Thunder Bay District Health Unit received funding to do the Thunder Bay Drug Strategy from the Health Canada folks. And it was a real challenge to get that money, because in fact, at that time, the Harper Conservatives did not even want the health unit to talk about alcohol or prescription opiates. Can you imagine that, Dr. Pulowski? What do you think are the two main problem substances in our community? Those two things. So Health Canada officials worked really, really hard with the public health unit to make sure that the application could be funded and that we could have a community-specific drug strategy, and it is saving lives. So maybe, Dr. Stewart, you could speak a little bit about the SUAP funding and our commitment to ongoing mental health and substance use treatment that is community grown and that community delivered.
Thank you, Minister Hajdu. In Budget 2021, the government proposed to provide an additional 116 million over 2 years, starting this fiscal year, in the substance use and addiction program to support a range of innovative approaches at the community level to harm reduction, treatment, and prevention. And this builds on an investment in the fall 2020 economic statement of 66 million in that program. In addition, as Minister Hajdu noted, the government has invested $4 billion over 10 years in mental health and substance use supports provided to the provinces through bilateral agreements, and in addition has invested in other tools in the budget, including through Wellness Together to support Canadians across the country with substance use challenges. Thank you, Mr. Chair.
Do I have any time left, Mr. Chair?
Sorry, you have 7 seconds, so let's say no. Thank you, Dr. Pawlowski. We go now to
We go now to Mr. Thériault. Mr. Thériault, over to you now. 6 minutes, please. Thank you, Mr. Chair. Welcome, everyone. Minister, you won't be surprised about what I'm bringing up today. During your presentation earlier, I'll prepare a question about that. You said that you would be investing in research, but there's a 22.6 reduction in the Canada Institutes of Health Research, even though we know that the vaccines on the mRNA platform are the fruit of decades of research on RNA, fundamental research. How can you justify that cut when it goes against what we should be doing to ensure retention of our best minds and so that we can continue to be leaders in research?
Well, thank you, MP Thériault and Mr. Chair. I'll just say that it's incorrect assumptions. I will say this: Budget 2021 investments include $500 million for the Canada Foundation for Innovation, $250 million to create a new Tri-Council Biomedical Research Fund, $92 million for ADMARE to support company creation, scale up, and training activities in the life sciences sector, $59.2 million for the Vaccine and Infectious Disease Organization to help it develop its vaccine candidates, and on and on.
Excuse me.
To Mr.
In 2020-2021, there was $1.6 billion. Now, the funding will be $1.25 billion rather. That's a decrease of 22.6%. When we want to foster research, fundamental research, the budget should at least be maintained. We shouldn't make the same mistakes as the past. But I don't want to lose my time on this. But these are the numbers that I've seen, and that's based on the analysis from the analysts from the Library of Parliament. So they're good numbers. The Specialist Doctor Association of Quebec, the Canadian Medical Association, cardiovascular surgeons, gastroenterologists, radiologists have all come to tell us that we have trouble ahead. You've given money, you've talked about the $19 billion to address the pandemic, and that would be for managing COVID patients, but non-COVID patients currently are going to find themselves in a situation where all those people came to tell us that over the next 10 years, we'll see the consequences of the ramping down, of less diagnosis, and we'll have an increase in mortality of 10% every year. And from a medical and economic point of view, given that this will increase costs for cancer, we're talking about cardiovascular issues as well, the two main causes of death here in Canada. So costs are going to skyrocket if we don't invest recurrently with the health transfers. It'll be much more costly tomorrow and after that, and in the terms of human lives. So what are you waiting for to do your fair share? Because the provinces are investing $200 billion, the federal government $42 billion, and we're asking for an additional $28 billion. You spent $340 billion last year. This year, $150-some billion. Why not make that $28 billion an urgent matter and take care of the non-COVID patients?
Thank you, Mr. Chair. If I have a moment, I'll just first of all pick up on the last part of the conversation and just indicate that not only is it direct research that's being funded, but also through the biomanufacturing sector, Mr. Speaker, investments of $1 billion over 7 years for the Strategic Innovation Fund so that we can fund research in domestic life sciences and biomanufacturing firms, $250 million over 3 years.
Why are you cutting 22%? Why cut 22%?
million on a cash basis over 5 years to create a life sciences stream. And so, Mr. Speaker, I'll just say that our commitment remains strong to support research through a number of different arms of the government and in a number of different ways with different partners on provincial transfers. As the member opposite knows, the Prime Minister has been very clear. He is committed to having conversations about increases to transfers, but first we stay focused on getting the country through COVID-19. We have not hesitated to be there with money when money is needed.
But it's not time to talk about it, Minister. These people have come to tell us that it's not time to talk. There are consequences on people's lives and their quality of life. A colonoscopy costs $1,000. Early cancer screening is essential. If we don't do it, with 155 patients on wait lists at the end of the year, we'll have 200,000 patients on wait lists in Quebec alone. If we don't invest now in a predictable way, we will be losing lives and there will be skyrocketing healthcare costs. It doesn't make sense medically or economically or from the budget's perspective.
Mr. Chair, I know Dr. Strong is here, so I just wondered if I could turn to him for a moment to respond to the research investment so that he can speak about budget 2021.
Excuse me, Mr. Chair. I wasn't hearing the interpretation.
Pardon me, Minister. We'll just check for the interpretation. Is there interpretation now, Mr. Thériault? Do you hear interpretation at this point? Not yet?
Oui, c'est revenu.
Yes, it's back.
Okay, I believe we have interpretation, so
Il me reste combien de temps, monsieur?
How much time do I have left, Mr. Chair, with all those cuts?
Your time is actually up. You're about half a minute over, but we'll let the minister or the various witnesses respond to your questions fully. Thank you. Go ahead.
Thank you, Mr.
Thank
Chair.
you. Oh, sorry, go ahead, Dr. Strong.
Okay, thank you very much, Mr. Chair. Please respond to that question.
But I asked the question to the minister. The question was for the minister. What is this attitude of sending basic questions that require a political answer? It's not Mr. Strong who would be deciding whether or not to increase health care transfers. I asked the question about health transfers, Mr. Chair. I want the minister to answer my question.
Les fonctionnaires sont là.
Public servants are here in support. If we want to speak to them, we'll speak to them. We've already done that.
Je veux une réponse de la ministre.
I want an answer from the minister.
If the witnesses may respond, it's up to the minister to decide who responds on her behalf. So go ahead, Minister.
Dr. Strong, thanks. Go ahead.
Thank you very much, Mr. Chair. In fact, the numbers that the member is referring to actually include what are called statutory dollars as well in the $2.6 million component, which are the dollars that were invested by this government directly into the COVID-19 response, the whole of government research component in there. So they are dollars which were rapidly brought into play, led to over 20 different research programs to address the pandemic response, but are one-time dollars. The core budget of the CIHR has in fact grown between these 2 years and will continue to support the types of really valuable research that is non-COVID directed that you have asked about. So the numbers to look at are in fact the comparators of 2019-20 to the current one, and not last year's because of the extraordinary investments that were made. Thank you very much.
Merci, Monsieur Thériault.
Thank you, Mr. Thériault.
Mr. Davies. Mr. Davies, go ahead. 6 minutes.
Thank you, Mr. Chair, and thank you to all the witnesses for being here. Minister, Canada's Chief Public Health Officer is an international expert in infectious disease and global health security, and she has repeatedly stated, quote, "No one is protected until everyone is protected," end quote. Yet your government is refusing to support a request to temporarily suspend WTO rules that are preventing nations from producing vaccines to protect their citizens. Is your own chief medical officer wrong, or is your government's position at the WTO wrong?
Well, thank you very much, Mr. Speaker. And I would say thank you for recognizing Dr. Tam's expertise and for acknowledging that she has a wide body of expertise. And she's absolutely correct. No one is protected until we all are protected. We know that COVID-19 is raging in a number of countries as we speak, including ours, and that we all need to focus on reducing domestic transmission. In regards to the question about the WTF, that is a question for my colleague, Minister Ng.
Okay. Switching to a different subject, the Canadian Dental Association says at least 32% of Canadians, 1 in 3, don't have dental insurance. Millions of Canadians suffer from oral disease because they can't afford to visit the dentist. Now, this disproportionately affects Indigenous people, children, single-parent families, women, and low-income Canadians. It leads to pain, serious illness, mental health issues, social exclusion, and loss of employment opportunities. Minister, considering that oral health is as important to overall health as any other part of our body, why is your government doing nothing to address this serious gap in public health care?
Well, thank you very much, Mr. Speaker. And I'll just say this. I agree with the member opposite that we need to treat the body as a whole unit. As I've said to him previously, privately and publicly, if this committee would like to study how a national dental program would look in Canada, we would be happy to hear your deeper thoughts about how that would work across the country. Obviously, the intersection with provinces and territories, as all healthcare delivery is very important. And so I look forward to the advice of this committee in that matter.
Thanks. Minister, do you believe that criminalizing drug use works to discourage drug use or promote recovery?
Mr. Speaker, our government has been very clear that substance use is a health issue, not one of criminality. We know that there is a role to play for law enforcement to be at all tables. In fact, the member opposite may or may not realize that I was the author of the Thunder Bay Drug Strategy, and law enforcement played a very important role in creating that strategy and being an important partner at the table. We know that problematic substance use is best met with compassion and with treatment, and indeed culturally appropriate treatment.
Okay. Minister, the opioid overdose crisis is Canada's other pandemic. Over 20,000 Canadians have died since your government took office. And last year was the worst year on record. Public health officers, addictions experts, people with lived experience, families, and even the Canadian chiefs of police are calling for decriminalization and regulation of a safe supply to stop the poisoned criminal street supply and save lives. Yet you and your Prime Minister refuse to follow this informed advice and overwhelming evidence. Why?
Well, thank you. I think it's a bit of a misleading question. In fact, this government has, legalized one previously illegal substance, and that would be cannabis.
People aren't dying from cannabis, Minister. We're talking about opioids.
What?
And you're criminalizing opioids. You refuse to decriminalize opioids. That's the question. Why do you refuse to decriminalize opioid use?
I'm sorry, Mr. Chair, you can tell me if you'd like me to answer the question or not. The member
you haven't answered a single question so far, so I feel the need to interrupt, Minister.
Mr. Davies, please let the Minister answer. We need to be polite and courteous towards our witnesses.
Well, I will say, Mr. Chair, it's discourteous not to answer questions that are put to the Minister. She hasn't answered a single question I put to her. But anyway, carry on, Minister.
Well, I disagree, Mr. Chair, and I will answer this one. As the member opposite knows, the City of Vancouver has applied for a Section 56 exemption to decriminalize substance use in Vancouver. We've received the receipt of the first packet of their information and their proposal. I've spoken with Mayor Stewart many, many times about his plans and his vision. And we've also been advised by the province of British Columbia that they are also looking at decriminalization as a partial solution. But as the member opposite may or may not realize, there is no silver bullet to reducing suffering associated with substance use. And that's why we have made it far easier for provinces and territories to, for example, stand up safe consumption sites and to prescribe safer supply options to patients. And some provinces have taken us up on that, Mr. Speaker, and some
Minister, the question is not about harm reduction. The question is about decriminalization, and your government continues to criminalize drug possession through the Controlled Drugs and Substances Act. My final question is on that exemption. It's been 4 months since the City of Vancouver requested a Section 56 exemption, and it's followed by the request from the BC government. Every day that we fail to act, every day people die in this country, 10 people a day. Why are you taking so long to grant this request?
Well, I don't know if the member opposite has spoken recently with Mayor Stewart, but in fact, his office and mine have been working together very collaboratively and working through some really thorny issues about their proposal. And as the mayor knows, we are standing ready to receive additional information, and we'll continue to assess their plan with the City of Vancouver. As I've said, we're always open to solutions that communities determine for themselves will be helpful to reduce the suffering and overdose deaths for opiate users and other substance users.
Thank you, Mr. Davies. So that brings round one to a close. We'll start round two with Mr. D'Entremont. Mr. D'Entremont, please go ahead, 5 minutes.
Thank you very much, Mr. Chair, and welcome to the Minister and officials. I want to go on and talk about Switch Health, of course, the company that's responsible for managing the COVID-19 testing for travelers. And there was an article, or a couple articles now, of people that are waiting 18, 17, 19 days to get out of their quarantine. They're struggling to meet deadlines. For example, Dynacare has taken over processing in Quebec for language reasons and others. Users have complained about significant delays before receiving their test results, to medical test kits being lost, of course, in process. So to date, how many samples have been lost by Switch Health, and do they even know?
Well, first I'll start, Mr. Speaker, and then I'll turn to Ian Stewart. I'll just say that we've worked extensively with Switch Health, and yes, indeed have replaced them in the province of Quebec, and we insist on quality services that we have paid for, and so we won't hesitate to replace Switch Health as well if we cannot get the quality that we need for day 10 testing. But I'll turn to Mr. Stewart to speak about that work.
You're on mute.
Sorry, thank you very much for that question. Regarding the number of tests lost, which the member asked, by Switch Health. I don't have that number in front of me. I'm not sure that they have lost any sample tests, but we will investigate in order to respond. I don't believe any, but we'll double check.
Okay, well, according to that article, Tony Latvia, a guy from BC, apparently they've lost it 3 times. So I don't know if they're losing it or whether their courier service is losing it. How many samples have taken more than 48 hours, let's say, to be processed by Switch Health?
That's for me. You're directing the question to, sir?
Yep.
Oh, okay, thank you. So we have had performance issues on turnaround times of the nature you're identifying, and there have been delays, and we've been working with the company to improve their turnaround time.
How many samples have not been processed by Switch Health?
Within a 48-hour window, as you asked. Off the top of my head, I'm afraid I don't have that statistic, but I will affirm that, yes, there have been delays.
How many have been maybe mixed up by Switch Health, where some people are getting the wrong results?
I'm not aware of that occurring. Actually, these are medical samples that are identified to specific patients. And I'm not aware of switches occurring of that nature, but we can investigate to respond to you.
Okay. And is the government tracking complaints to Switch Health? So is there a complaint mechanism for folks that don't seem to be serviced by the service?
We have complaints mechanisms for each of the stages of our testing and quarantine. And yes, we do track the complaints.
How many? Okay, keep going. Okay.
Well, you were going to ask me. I'm sorry. Go ahead.
Well, no, how many at-home tests are being administered at this point by Switch Health, and what is their volume supposed to be?
So the at-home tests, which are predominantly day 10 tests, we have done around about 96,697 at-home day 10 tests. So that would be, I think, the best answer for you in that regard. Okay. And we do track the complaints, as you've been mentioning. The number I have in my head is about 182 complaints have been filed with us.
Okay. You can switch over for a quick second here because I know I'm getting closer to the end of my time. Maybe for the minister, when it comes to the PNPRB changes, I know those are supposed to be coming in another month or so. We're still hearing from patient groups that are asking for some changes or at least a phased-in approach. Have you considered changes to how PNPRB will be operating in their new regulations?
Well, thank you very much for the question. As the member knows, Canada pays an extraordinarily high cost for prescription medications, and the changes that we propose are really about making sure that medication is affordable for all Canadians. And we've delayed the implementation of the PNPRB to reflect the incredible strain that the industry has faced trying to switch to a variety of different therapeutics and research related to COVID-19. We're going to continue on the path to making medication more affordable for all Canadians.
And how about the folks that are saying that they're not going to be able to get therapeutics into this country for, up to 9 years in some cases? So there's a different challenge there of what we're saying on prices and what groups are saying on being available or having those available products.
I'll just say I'm always willing to meet with patient groups to talk about their concerns about drug pricing in the country and how we can better ensure that high cost drugs are available. Many of those patients are patient groups that are supporting family members with rare diseases. And of course, we do have a rare disease strategy that is under development as well that may be able to take into account some of their concerns. And of course, they have had an opportunity to weigh into the development of the rare disease strategy as well as many other experts. That strategy is very specifically focused on, in particular, some of those patient groups' concerns around the cost of these extremely expensive drugs for very few people. And that needs a separate strategy.
Thank you, Mr. D'Entremont. We'll go now to Ms. O'Connell. Ms. O'Connell, please go ahead. 5 minutes.
Thank you, Mr. Chair. Committee members, I'd like to spend some time. Unfortunately, Ms. Ramble-Gardner has gone down the same path as Mr. Polyev in terms of misrepresenting committee testimony. So we're going to do a little round of correcting the record here, if I may. So on Twitter, Ms. Ramble-Gardner just posted that comments made at this committee just now that, quote, 3 doses of vaccine might be needed for those subjected to dosing interval delays. Now, I didn't hear that in the witness testimony just now. So perhaps to Dr. Tam, we could clarify the truth here and correct the record straight in terms of potential third dosing and I don't know where this came from, this interval delay. So could you perhaps provide us some context here?
Yes, thank you. As per the recommendation of the National Advisory Committee on Immunization and consensus of the Provincial Chief Medical Officers of Health as well, that the best strategy for Canadians at this time is the first dose fast, because it provides broad coverage with an effective first dose for as many people as possible. And that interval is being watched very carefully, and that we have not seen any waning of that effectiveness at this point. However, any scientific information, for example, from Pfizer, needs to be examined. And we are prepared to examine that with the National Advisory Committee on Immunization. We do not know about this third booster. It is something that must be further scientifically examined and watched carefully over time. But it's an important question, and we will obviously provide the information to Canadians and health providers as fast as we can get the actual scientific analysis.
Thank you. And isn't this idea of a booster being considered in countries around the world, regardless of dosing timeline and more in response to, the vaccines themselves, variants, and just better understanding the virus?
Yes, that is correct. All manufacturers are paying attention to this, as well as public health systems, because as we all know, the virus undergoes evolution. And it is actually really important to get ahead of the curve, particularly as some of the variants that have been identified around the world have the potential for reduction in that vaccine protection. So I think it is absolutely the necessary and prudent step. And then there will be further, as you've seen, the systems in place to authorize through the regulator to get the expert opinion and then provide the advice on whether a booster dose is needed, but we need to prepare for the potential for that to happen.
Thank you, Dr. Tam, for clarifying for the record. Mr. Chair, through you, in regards to the other point of the tweet that just went out misrepresenting, I believe, what I heard with my own ears in this committee was that officials, quote, officials have given government advice regarding potentially grounding or reducing interprovincial flights. Again, Mr. Chair, that's not the testimony I heard from Mr. Stewart or the minister. So perhaps you could clarify, as well as the fact that it has been widely reported that premiers are perfectly able to initiate interprovincial travel restrictions, as has been done in Atlantic Canada. So could you perhaps correct the record and clarify your statements?
Thank you for the question. What I was trying to say is that we do scenario planning in a wide range of areas. We have not given specific advice to ground flights at this time. From my group, from the Public Health Agency of Canada, we have not given specific advice to do that. As the member notes, in Atlantic Canada, provinces have had the jurisdiction and the wherewithal to organize measures of natures around limiting interprovincial travel, and of course, other provinces have the similar ability. Thank you for the question.
And I'll just add to that, Mr. Chair, that as the Prime Minister has noted, a number of provinces and territories have restricted entry or imposed provincial quarantines for travelers. And that is, of course, every premier's choice if he wishes to do so. I almost said if he or she wishes to do so, but I realize there are no more female premiers at the moment.
Thank you, Ms. O'Connell. We go now to Ms. Rempel-Garner. Please go ahead.
Thank you, Chair. To Dr. Lucas, the COVID-19 testing and screening advisory panel, has the government received or your department received the report from this panel?
Mr. Chair, the testing and screening panel has prepared and released 3 reports. One in February pertaining to the overall approach on rapid testing. They've had one on long-term care as well, and one on testing and screening in schools.
I believe there was one additional report that hasn't been released to the public yet, correct?
The committee, Mr. Chair, the committee continues its work, and as the work is completed, reports will be released.
Thank you. And so the department does not have any reports in its possession right now from that panel that have not been released to the public.
Mr. Chair, the panel has not completed any reports for release at this point, and when they do, they will be provided to the public.
Okay, thank you. Dr. Tam, do you agree with this statement? 1 dose of Pfizer COVID-19 vaccine still leaves patients vulnerable to variants.
It's very important for all Canadians to know that 2 doses are needed to complete the course. 1 dose or 2 doses are not 100% effective. So it's always important to complete the recommended schedules. 1 dose is a very effective dose, particularly in preventing ICUs and deaths.
Thank you. Given emerging data on the reduction in immunity associated with the Pfizer vaccine, perhaps I'll direct the question to Mr. Stewart. Is your department potentially going to give any advice on changing the dosing interval for the Pfizer vaccine? In terms of the dosing delay, like the maximum 4 months.
I see. Actually, it's Dr. Tam in the Public Health Agency of Canada who leads that work, Honourable Member.
Dr. Tam, are you considering any change to the 4-month dosing delay for the Pfizer vaccine at this time?
So the National Advisory Committee on Immunization indicates up to 4 months, and provinces have the ability to adjust. And I think with the increasing supply of vaccines coming in, I think we will begin to see them adjusting their intervals as they plan the implementation.
For people who will have had a 4-month dosing delay for those Canadians on the Pfizer vaccine, are you looking into the potential need for an additional dose of that vaccine for those persons beyond 1 and 2?
So the interval does not diminish the quality or the immunity of the vaccine. As to whether a booster is needed, that's actually a slightly different question.
So when you're talking about booster, you're talking about the same vaccine, right? Just given a third time.
It depends on the evolving science. There are clinical trials ongoing to look at mixed schedules as well. So that is not guaranteed, and we will follow the science and the clinical trials.
So in this context, when you're talking about booster, like I'm asking, will the same dose of the vaccine, so the same formula or whatever, potentially be needed more than twice in a patient who has had a 4-month dosing interval of the Pfizer vaccine in Canada?
So I think one fact that is not well understood by Canadians is that interval stretch does not diminish the response of that second dose.
And at all, you're certain of that?
For most vaccines, by the way, that interval actually enhances the immune response.
Including Pfizer. So if I have a 4-month dosing delay, I will have an enhanced immune response by having my second dose 4 months later.
It generally does not diminish the response of that second dose. So you don't have to repeat a dose just because of delay. Whether you need another dose as a result over time, and I think Pfizer actually studied people who've had the actual recommended schedule.
So just for clarity,
in terms of over time.
So there's a Globe and Mail article out right now that says that immunity may wane with an extended dosing interval on between 1 and 2. So you're not concerned that there would be requirement for additional doses or reduced immunity?
We're always watching for reduced immunity in that interval, and that is being watched closely. But it does not diminish the impact of the second dose. What will change recommendations, whether it's 1 or 2 doses, is whether there is a need after 2 doses to get another booster, and that is actually a different question.
And booster is the same formula?
We don't know yet.
Garner.
You don't know yet?
Thank you.
Thanks for the clarity.
Thank you.
Thank you, Ms. Rempel-Garner. We go now to Mr. Van Bynen. Mr. Van Bynen, please go ahead. 5 minutes.
Thank you, Mr. Chair, and thank you to our witnesses for taking the time to meet with us again. All of you have been very busy leading us through the pandemic, and I want to let you know that your time is valued and appreciated. Leading us through this pandemic has required using science-based evidence from the start. And as we were dealing with this new virus, this meant that as we learned more about it, our approach and our response has changed and adapted accordingly. That is science, and it is what is using science-based evidence requires. Canada is home to world-class scientists and public health experts, some of who are with us today. Their research has played and continues to play a vital role in building and evolving our understanding of COVID-19. There is no doubt that we need to continue to support and invest in our scientific community. Minister, could you tell us about the work that the federal government is doing to support COVID-19 research and our scientific community here in Canada?
Well, thank you very much. And I'll just say that one of the world leading experts on infectious disease we are so fortunate to have is Dr. Theresa Tam. And so thank you, Dr. Tam, for your hard work over the last many months and indeed your expertise. You're absolutely right, MP Van Bynen. I'll just say that this government firmly believes that science and research, not just in the context of the pandemic, by the way, but certainly accelerated by the pandemic, that investment is incredibly important to the health and safety of Canadians. And in particular, health research, of course, helps unlock many mysteries and reduce suffering and help Canadians have healthier lives now and into the future. And that's why we've made historic investments of over $10 billion since 2015. We had a long ways to catch up after the previous government, as you know, the ongoing attacks on science, both from a financial perspective and actually from a destruction of evidence perspective, if you can believe it, Mr. Speaker. And so we've been working with provinces, territories, leveraging the expertise of virologists and immunologists and other experts all around the country who have stepped up many times in voluntary ways to help the government of Canada and indeed provincial governments have the best possible response to COVID-19. We led a rapid and unprecedented response to COVID-19 through the CIHR. I'll never forget that early announcement in February of 2020 in Montreal with some of my colleagues. That was within weeks of COVID-19 appearing on the world stage, and obviously took just several weeks to get in order. And of course, Budget 2021 would provide, if passed, a further $2.2 billion to grow our domestic life sciences sector. So it is really about an ongoing and sustained investment, Mr. Speaker, in research, in science, in the science community, and in generating that next crop of researchers and scientists through the many investments we've made through my colleague Minister Qualtrough's department, the ESDC department, that focuses on ensuring that Canadians have access to post-secondary and integrated learning opportunities that's going to foster the next crop of researchers. Thank you very much.
Thank you, Minister. Over the last few meetings, we've heard from witnesses representing different organizations that work with those most vulnerable in our society. And among them are those who safely isolating at home isn't an option. We've all heard of heartbreaking stories of multi-generational households where one member contacts COVID-19 in the workplace and transmits the virus to their family members. For these individuals, isolating safely at home is not an option. Minister, two questions. Why is it important for Canadians to have a safe place to isolate, and how is the federal government helping Canadians in these situations?
Thank you very much. And through the chair, I'll just say it's such an important observation that what we do at community level matters. And so understanding communities and the limitations of families to safely isolate was a very important early understanding of our government. And we knew that communities would do the hard work if they had the financial resources in place to be able to provide spaces for folks that couldn't isolate well. I'll tell you, I'll use a personal example in my own community of Thunder Bay, Ontario, when we had and Dr. Pawlowski will recognize this, when we had a significant surge just a while ago, it was indeed amongst a group of people that are very marginally housed. And people often think of folks that are experiencing homelessness, absolute homelessness. There's shelters and nothing else. But what we actually know is that people intersect with family, they have roommates. There are all kinds of situations where people are trying to essentially avoid shelters. They are really a last resort in someone's life. And very quickly, it became clear that our community spread was being driven by folks that were very vulnerably housed. And that would help the community would be isolation housing, so that if someone was living in a situation with multiple family members or roommates that couldn't physically isolate, that they would have the space to do so, and that they would be supported to stay in place. Because of course, just sticking someone in a room isn't good enough. They need to have access to food, in some case medical supports, counseling, and a variety of other things that they need in their day-to-day life. And of course, people need to be monitored if they've come into contact or are sick with COVID-19, because of course their condition can worsen. So when I say that COVID-19 is a lot of work, that's just a snapshot of the kind of work that communities are putting in to help protect vulnerable people and stop the spread. And isolation housing has been an important part. So we allocated $100 million to municipalities and health regions so that they could, in fact, have space to do that hard work, but not worry about the money that it would cost to rent locations, clean locations, and indeed staff locations. And so it's been another example of the federal government stepping up for local communities to help them really stay focused on community transmission.
Thank you.
Thank you, Mr. Van Bynen. Nous allons maintenant, Monsieur.
We will now go to Mr. Thériault. Mr. Thériault, go ahead. Thank you. 2.5 minutes. Dr. Strong, the Canadian Institutes of Health Research, there's a difference versus last year of 22.6%. And it's true that there's an increase of 4.3% versus 2019. However, my question is, why not have maintained the $1.6 billion of 2020-21 when we know we need to support research and that it's essential for the coming years? That was my question.
Mr. Chair, thank you very much for that question and the further clarification being requested on that one. There really are two issues that are at hand there. The budget for research in and of itself for the CIHR to support
I understood that, Mr. Strong. I'll let you answer, but I don't have much time. I'm asking you, I know full well that there were cuts. I'm asking why not have given that to basic research and maintained the budget at the same level. That's what I'm saying. Why not have maintained it? I'm not asking where you cut or how it works. I'm asking why not maintain that budget? Why not invest in the situation we're experiencing and the importance of basic research for coming years? That's my question.
Thank you very much, Mr. Chair. First off, there have been no cuts to the budget of CIHR. The dollars that you are asking specifically about were dollars that were one-time investments for immediate response to the pandemic itself, such as that the minister referred to within weeks of the declaration. So these are one-time investments and not a cut to the budget in and of itself.
Oui, bon, d'accord, c'est...
Okay, that's a senior official type answer. I don't have a problem with that. But what I know is that the government decided to spend $1.6 billion, and then this year it will be $1.2 billion. So now what you're saying is it was because of the pandemic, but we're still experiencing the pandemic, and basic research has never received a lot of funding. It's always been a little neglected, and we've lost a lot of great minds over the years. We shouldn't repeat the mistakes of the past. So my question wasn't, how do you break this down? Why is it that we don't have a recommendation? And why don't we foster research and maintain the budget, especially since we're still going through the pandemic? I don't need your answer. I know what it would be like. And it's not what I would be looking for.
Merci.
Thank you. Thank you, Mr. Thériault.
The witnesses may respond.
Thank you very much, Mr. Chair. What the budget means that the member are looking at do not include the investments the substantive investments that have just been made by the government in ongoing research, including clinical trials, including research networks to support biomanufacturing. So these numbers will look considerably different as those investments are included, and they are multi-year. Thank you.
Thank you. And thank you, Mr. Thériault. We go now to Mr. Davies. Mr. Davies, 2.5 minutes, please.
Thank you, Mr. Chair. To anybody who might know, how many passengers arriving in Canada have tested positive for COVID-19 after leaving their mandatory 3-day hotel quarantine? Does anybody have that figure?
Yes, we do actually. So to answer the member's question, we do a test before you arrive. As you know, there's a first test where you go into the hotel.
Let's just do it with I have very limited time. I just want to know how many passengers have tested.
And positive. I am trying to work myself to explain that between the first test and the second test, we are able to answer your question, and that is the number of people who test positive at the day 8 test. And the figure is about looks to be about 1.5%. So about 1,400 people out of about 96,000 so far for the data we're tracking.
And thank you, Mr. Stewart. And of that, how many were infected with a variant of concern?
That's an excellent question, sir. Thank you. We actually sequence all positive tests that are exactly the way you're referring to. So far, we've had 1,700 variant of concerns or variants of interest, which are ones which are still under study. that have been identified, and I just need to go on to add, they were identified by people who are in quarantine. They were not released into the community. Those were people where they were tested positive, it was sequenced, and we were known while they're in quarantine. So we caught them in effect.
Okay, good to know. Thank you. Minister, according to a recently released report from the Canadian Institute for Health Information, COVID-19 cases among residents of long-term care and retirement homes increased by nearly 2/3 during wave 2, that ended February 15th, compared with the first wave, and resident deaths were also higher during wave 2. Minister, given that your government pledged to set new national standards for long-term care last September, and given that, let's face it, we have decades of research, we know crystal clear what standards should be in place. Why is your government refusing to implement national standards and instead simply kicking the can down the road by doing more consultation?
Well, I think it's incorrect to say we're refusing to implement long-term care standards. In fact, it's in the budget. It's in Budget 2021, and I have repeatedly spoken about it. And of course, the member would know that because healthcare is the responsibility and the right of provinces and territories to deliver, it has to be done in partnership with provinces and territories. That work continues. And we've been there, by the way, Mr. Chair, as you know as well, throughout wave 1, wave 2, and any future waves for provinces and territories to strengthen protections in long-term care, including, by the way, funding infection prevention experts to help reduce the introduction of COVID-19 into long-term care.
Quickly ask the minister then, when might we see national standards? I understand the Constitution and provincial healthcare delivery, but national standards are by the federal government. When might we see those national standards by your government?
Well, again, Mr. Chair, I'll quickly respond. I think the premise of the question indicates a fundamental lack of understanding that we could not impose those on provinces and territories. They're responsible for providing the healthcare. So it is a collaborative work that we do with provinces and territories. It's important to have them. They are, by the way, the subject matter experts. They are the ones running the institutions and running the sector. And so we have to work with them. You're right. There are many research studies and there are many organizations that have expertise in setting standards, but this is collaborative work. It always is. We are a federation. And I know the member opposite struggles to understand that we don't have the responsibility or the right to deliver healthcare, but that I would like to remind them that we have been in an unprecedented way there for provinces and territories to help them through COVID-19 and beyond.
Thank you, Mr. Davies. That brings round 2 to a close. We'll start round 1 at this point with Mr. McGuire. Please go ahead, Mr. McGuire, 5 minutes.
Thank you, Mr. Chair. I just wanted to relate this in the emergency debate on Monday evening, but I'm just wondering what we can get for changes out of this. Purolator doesn't really have a presence in a lot of rural areas in Canada, and people are having a difficult time sending in their PCR tests without in the allocated time frame. A mother shared with me that the ordeal of her son had to go through because Purolator doesn't come out to the community every day. She waited on hold for hours and hours and was told then that someone would be coming to pick up the package. And lo and behold, they never got there. They waited another day, a full day, and then were told to leave the package outside at a building in their local community and Purolator would pick it up. And so by the time the package got back to get tested, almost 5 days had passed. So I'm just wondering about the results, the reliability of those results, and will you commit to working with other couriers and engage in private sectors to fill the gaps in these rural areas where Purolator is having trouble picking them up, if at all?
Mr. Chair, I've been very clear that if Switch Health doesn't deliver, we will find another provider. And in fact, we've been working with Switch Health, but we will not hesitate to replace them if they don't meet the needs of Canadians. Maybe Mr. Stewart can speak a little bit more about the work that they've been doing with Switch.
Well, thank you for the question, Mr. Chair. First of all, it's distressing to hear the anecdote, so thank you, Honourable Member, for sharing it. We do, in fact, have a number of couriers that we're working with, and we have experienced delays in people in getting service responses, and so we note that, and thank you for that feedback. The Purolator system doesn't always go to every household in Canada, and sometimes there are drop-off sites that you use in more rural areas and so on, and that may have been part of the issue here. But we note with interest your comment, and thank you for the feedback.
Yeah, even at that, they were told to leave it outside. So I'm just wondering, you mentioned earlier, I think your answer to this was 1,400 people that have been infected landing in our our 4 designated Canadian airports. I'm wondering how this can happen when they actually have to have a negative test before they get on the plane. I know there's a time frame in there of 72 hours, but is that a correct number that you just gave us? 1,400 out of 96,000?
Yes, that was the question. Sorry, if you want me to answer it.
Yes, please.
That was the correct number for the day 10 positives. It was 1,400. But with respect to the 3 tests, how many get caught by the first test, how many get caught by the second, and how many get caught by that third day 8 test, that's a function of the profile of how infection moves through the body and when people are detectable, as it were. And Dr. Tam is better positioned than I am to explain the cycle of the disease in that way, as it mounts infection and as we can detect it. The reason why we do multiple tests is because people can arrive and have tested negative, and then 2 days later, enough infection has now grown that you can detect it.
And I might also add, Mr. Chair, that the number alone doesn't tell the full story, because in fact, it's about 1.4% of total travelers that are found to be positive with COVID-19. So it's important that we take things in perspective.
Well, the perspective I see is the news that I heard this morning where the U.S. has about 28% of their population has got the second dose. We're at 2.8%. The U.S. has also got about 2/3 of their people with the first dose, and we're at the, our first dosage is at the same level as the Americans that have second dosages. Their caseloads were down about 8% this week. And so in the spirit of transparency and accountability, I just want to know if you can make a commitment here to table with the health committee every time a vaccine shipment is delayed and within 72 hours of being notified about the delay, which would include the name of the company, how many individual doses were delayed, and which provinces will be impacted. Could we have a commitment to have that transparency?
Mr. Chair, what I will say is that transparency already exists, and on the Public Health Agency of Canada, all members, indeed all Canadians, can track the shipment delivery that we have that is confirmed by manufacturers, and indeed any delays are also reflected in a revised delivery schedule. So provinces and territories know, and Canadians know exactly how many vaccines are coming into the country and from which manufacturers.
Yeah, I'm just wondering if you could table that when it's available. So
it's available it's available in real time, Mr. Chair. Certainly, we can send a link to the committee where they can follow along.
Thank you, Mr. McGuire. Sorry. Thank you, Mr. McGuire. We'll go now to Mr. Kellaway. Mr. Kellaway, please go ahead.
Thank you, Mr. Chair, and thank you, colleagues, and hello to you, and thank you to the witnesses as well today. My question is for Minister Hajdu. So, Minister, in the last week, the COVID situation in my home province and MP D'Entremont's home office of province of Nova Scotia has been a great cause of concern for me. In just 2 weeks, we went from 42 active cases to 589 cases, with the majority, Minister, of those new cases being reported just this last week. So I have to tell you, though, and tell you and tell Canadians, I'm so proud of my constituents and all Nova Scotians who have been getting tested to identify and reduce the spread of the virus in our communities. Also in Nova Scotia, we are so lucky to have provincial leadership that has taken this pandemic seriously from the beginning. So we're now in day 3. We're in day 3 of our 2-week province-wide shutdown. And I know that Nova Scotians will do whatever it takes to get this virus out of our province once again. So I want to thank you and the Prime Minister for your role in supporting provinces and territories as we fight this virus together. So my question is simply this. Can you tell us more about the direct supports that our federal government has provided to provinces and territories as we fight this third wave?
I can, MP Kellaway, and through the chair, I'll just say I do want to congratulate Nova Scotia for their very rapid action on putting out the cases of COVID-19. That's exactly what helps communities when provinces take quick action like Nova Scotia has. And I have to say a hello to Minister Delory, who was the Minister of Health, and I worked with very closely and is really proactive. And of course, Minister Churchill now, who is working on the file, and of course the Premier Rankin. Their leadership has been really a model, not just for Canada, but for the world, because in fact, what they realized is that they cannot allow community spread to continue, and that the best marker of safety is less COVID. And that when there is less to no COVID, that's when we can actually see these outbreaks, and you can see when cases are growing. So I just want to thank them. But, MP, we have been there, as you know, for the province of Nova Scotia, as well as all other provinces and territories. And for example, through the Safe Restart Agreement, providing billions of dollars for preparing for resurgence. So the testing that Nova Scotia is now becoming famous for as well. Extensive testing, rapid testing pilots, making sure that anyone who is experiencing illness, or that if a public health unit needs to test contacts, that they have the capacity to do that. That is federal government funding, and federal government tests, by the way, that we provided free of charge to provinces and territories. The data capacity, data is actually a huge component in managing and tracking COVID-19. The ability to put together those webs of how people interact and who's coming in contact with who, and really tracking how the virus is spreading. That data has been essential. And of course, we supported provinces with that. All the PPE, MP Kellaway. So the PPE that's being used in hospitals and community settings and healthcare settings across each province and territory, purchased for provinces and territories by the federal government. And then, of course, additional supports like contact tracers and isolation centers and rapid tests, as you know. So we continue to be there for provinces, including Nova Scotia, for whatever they need. And what's really been, for me, very fulfilling, despite how challenging it's been, is the personal relationships I've developed with other health ministers who, regardless of party, I might say, know that the phone line is open, and they all have my cell phone number. We speak on a regular basis about how things are going, what they need, and where we can best support them at the federal level.
Thank you, Minister. On Saturday, I think it was quoted in the press that there were approximately 15,000 tests that were had in just one day. And comparatively speaking, I think it was this time last year, or maybe a little later, there were approximately 200. So the advancements that we've made have been immense. And again, I can't thank you highly enough. And also the people of Nova Scotia, to see it's a real inspiration to see everyone coming together to really stamp this out. So I have one more question. And I think it's overused, but it's apt that COVID-19 has changed our day-to-day lives. Yet, we have been finding rather innovative ways to adapt. So my question is around virtual care. And I'm just curious, how is the federal government supporting Canadians in expanding access to virtual care services? Because we're upping our game there. And I'm just curious to get an answer to that question, in particularly for the rural parts of my riding.
Well, thank you very much, MP. And through the chair, you're absolutely right. I mean, there are I would say, few silver linings to COVID-19. Maybe that's just my perspective today. But one of the silver linings is that it really accelerated provinces' commitment to creating fee codes for virtual care and empowering physicians across the country to use virtual care and be able to be compensated for providing virtual care. Now, this is a game changer, and it's a game changer for places like Nova Scotia and my own home community or region of Thunder Bay, Superior North. I'm looking at Dr. Pulowski, who would have struggled to be able to provide care for patients in remote communities that maybe would have just wanted to talk to him to follow up. And this is an ability actually for Canadians to get access to care. Now, it doesn't replace, obviously, face-to-face care, and I don't think anyone would expect it to, but it certainly can help get people access to primary care much more quickly. So last May, we announced $240.5 million to support this work, to enhance digital tools, for example, secure messaging, digital video conferencing that was secure, because of course, confidentiality, privacy issues, very important in the context of healthcare. We've got 7 bilateral agreements for virtual care with provinces and territories signed, including one with Nova Scotia, and investments of over $98 million towards that. And also, we immediately knew that this would create mental health stress for Canadians across the country, and we launched wellnesstogether.ca. Now, this is a provision of mental health service support for Canadians, regardless of where they live, available online and through a variety of different ways. But the neat thing is Wellness Together is, essentially reaching Canadians that prior to this maybe had a hard time reaching out for help, didn't have coverage for help, or just hadn't thought about using mental health supports as a way to help with some dark moments in their life. And I'm very, very thrilled to say that we'll be sustaining that investment over the next year.
Thank you, Mr. Kellaway. We'll go now to Mr. Barlow. Mr. Barlow, please go ahead, 5 minutes.
Thank you very much, Mr. Chair. And my first question to Dr. Lucas. Dr. Lucas, can you answer, will the known traveler digital identity pilot project, which is included in budget 2021, will that be used to provide proof of COVID vaccinations for Canadians traveling abroad?
Mr. Chair, I may direct that question to President Stewart. It is not a direct area for Health Canada.
Mr. Stewart?
That is a Transport Canada investment, I believe, for border measure certification.
So Transport Canada is not talking to Health Canada on this issue at all? This is something none of you are aware of and how that will be used or implemented? No? Okay. I'll just go on. Minister, you've had a number of scathing audits in your performance, and they continue to pile up. Your own department's internal report from September has shown the slow response in the pandemic. The external review panel's interim report outlining the failure in canceling the pandemic early warning system before COVID. Certainly the Auditor General's report and the lack of pandemic preparedness, surveillance, and border control measures. And most recently, the Auditor General's report pointing out gaps in the oversight on the national natural health products. 2 weeks ago, my colleague, Mr. Davies, asked if you accepted any responsibility on the failures outlined in the Auditor General's report, and you did not, you avoided any accountability. Do you now accept some responsibility for the failures of the departments of which you were in charge?
Thanks, Mr. Chair. What I'll say is that we've been very clear to accept all the recommendations of the Auditor General. And of course, I would say that accepting, the responsibility includes, for example, appointing independent investigators into what happened with GFIN, making commitments to restoring the Global Public Health Information Network. This government has been clear that there is much to learn by this country. There is much to learn by every country, and we will be very focused on those recommendations and indeed ensuring that we have a world-class Public Health Agency of Canada and a world-class global pandemic response system going forward.
So I'll take that as a no. He won't take responsibility for some pretty significant failures in departments.
Well, actually, Mr. Chair,
no, I've asked my question. You've answered the question. You've answered the question. I am moving on. The recent Auditor General's report concluded that Health Canada did not ensure that natural health products offered Canadians were safe, effective, and accurately represented. Maybe to Dr. Stewart or to Dr. Lucas would know the answer to this question. Do we know how many Canadians were harmed or had medical incidents as a result of the adverse reactions to the natural health products in the past 5 years?
Mr. Chair, in response to that, I don't have that information at hand. I could follow up, but what I would observe is that Health Canada, in its regulatory areas, including the natural health products area, does have a strong system of oversight on safety, efficacy, and quality with the responses. Our response to the report of the Auditor General indicates that we are taking further action to strengthen that, including working with patient groups, the industry, and others to ensure that support and oversight is strong to protect Canadians.
Okay, thanks, Dr. Lucas. The Food and Drug Act and the regulations set out the reporting requirements of adverse reactions, which the department collects. Can you table with the committee the number of adverse reactions that natural health products have had with Canadians over the past 5 years? Can you table that with committee?
Mr. Chair, as I'd indicated, Health Canada will follow up and provide the committee with a report on reported adverse reactions to national health products.
Thank you. And maybe back to the minister. We've certainly had some evidence in that the hotels used for hotel quarantines are now advertising booking hotel quarantines stays well into September, now to the end of September 30th. But the most recent order in council mandates that the quarantine hotels will expire on May 21st. Is it your intention to maintain the quarantine hotels into September and into the fall of next year? And if so, why?
Mr. Chair, I will just say that we will follow the advice of the researchers and public health experts who are advising us on how best to manage the border, and we will be prepared to continue to isolate Canadians returning from international travel for as long as the virus is presenting threats to Canadians.
Thank you, Mr. Barlow. We go now to Dr. Pawlowski. Dr. Pawlowski, please go ahead. 5 minutes.
I have a bit of a technical question. It would seem like General Fortin might be the person to answer it, but this isn't really something he's been dealing with. I know that the government has agreed to deploy the Army, at least medical assistance teams, to Southern Ontario, and also the Red Cross in dealing with the large number of cases kind of overwhelming the healthcare system in Southern Ontario. So question number one, what exactly are they going to do? My understanding is that it's likely they have limited ICU capacity. I think the hospital in Kandahar had 10 to 20 ventilated beds. Certainly that's not going to make much of a difference in terms of stemming the number of people in ICUs. So one, how are they going to be used? And then the second thing is, and this is the important one for me, who determines what they're going to do? I know, being in contact with infectious disease doctors in London, Ontario, Oshawa, Markham, Stouffville, that there are infectious disease people there that are eager to use the bamlanivimab purchased by our government that's basically sitting on the shelves. They want to use it. They want to get into people's arms. Exactly where the problem lies in doing this isn't totally clear, but one of the problems is having infusion sites, and certainly having tents with medics and or nurses that could infuse them would certainly seem to me to be one way of addressing and trying to deal with the large number of people ending up in the hospital, when studies seem to indicate that you need to treat 8 people as an outpatient to prevent one hospitalization. So this is something we could be doing. Now, who makes the decisions as to what those Army units are doing? I kind of fear that it isn't going to be as simple as the doctors ask the Army for some help. It's going to be, well, the doctors have to talk to the hospital, it has to talk to the province, which has to talk to the science table, which has to talk to PHAC, which has to talk to, and it takes months for any decision to be made. So who's going to make that decision as to what the Army does? So one, what are they going to do? And two, who's going to determine what they can do? And I guess 3, how about using them to infuse monoclonals?
Mr. Chair, I'm happy to provide some comments. From past experience as commander of the Joint Task Force LASER, the response for the pandemic last spring, the Canadian Armed Forces are prepared to support, at the request of provinces and territories, and a range of capacity and a range of tasks that fit the profile of the capabilities that we deploy. And in this current case, given the pandemic and the way it's going, the way it's been, and the way it's affected the CAF, as well as other activities, mobile or medical assistance teams have been purpose-built to deal with the different requests, as we have seen in support of activities in Northern Ontario, Northern Manitoba, currently in Sunnybrook in Ontario. And they're really there to bolster capacity, provide assistance at the request of Government of Ontario. Maintaining military chain of command, they provide assistance to support the needs of the local hospital, local long-term care homes, or what have you, as they see appropriate.
So in terms of a chain of command, because I'm in touch with these doctors, they have to then get the Ontario government in the Ministry of Health to then put in a specific request to the Army to do a specific thing. So again, I'm focused on if they want to use the tents and the medics, the nurses to infuse monoclonal antibodies, they first of all would have to go to the hospital, which would have to get the Ministry of Health to then ask the Army to do something. There's no short circuit of this that they can go directly to the Army.
Mr. Chair, I wouldn't be able to respond in great detail about what the CAF is doing in terms of technical support, but I can tell you that we have an omnibus RFA, an omnibus request for assistance, and the current tasks fit the profile.
Perhaps Deputy Lucas, you can add a few words about the treatment aspect.
Yes, indeed. As Major General Fortin indicated, the Government of Canada responded to a request for assistance from the Government of Ontario. As part of that response, the Canadian Armed Forces deployed 55 personnel, including ICU nurses and the mobile medical assistance teams to Sunnybrook, where they're working with the hospital team at that location to provide support in a coordinated fashion. In addition, the government has provided a series of medical equipment to the Government of Ontario as well as other provinces, including ventilators and infusion pumps. In terms of the Eli Lilly monoclonal antibody therapy that you noted, that drug reviewed and approved on a rapid basis by Health Canada was purchased and provided to provinces. They're working with clinicians in terms of its deployment. I think that provides the context for support to provinces and to clinicians in Ontario and across the country.
Thank you, Dr. Pawlowski.
We now go to Mr. Thériault. Mr. Thériault, go ahead, 2.5 minutes. Thank you, Mr. Chair. My question is for the Minister regarding the pandemic or the review board for patented medicine. When Mr. Levin and Mr. Clark came to see us, they indicated that they hadn't done any impact studies on the life science ecosystem regarding the reform for this patented medicines prices review board. What do you think?
I can speak to former presenters at this committee, but I can just say that the work that we're doing right now is very important to lower the cost of drugs across the country. I have met with a number of states.
Did you know that there had been no impact study on life sciences regarding the effects of that reform? Did you know that? That's my question. I know the answer is no. Patient groups, and we want the price of drugs to go down. We're in favor of that. But it seems a lot more complex. Patient groups who've spoken to us, members of industry, and researchers in different research areas find that there's trouble with this reform. Everybody agrees that the comparisons should change, and that could lower prices based on briefs between 20 and 30%. At that point, what would remain to be done is to sit down and find points of convergence. Will you, on June 1st, address that basket of comparisons and then work with people to find the best solution so that our patients, our children, have access to innovative medicine that can save their lives?
Well, thank you, Mr. Chair. And I would say that our goals are the same, MP. It is to make sure that people can afford medication and that indeed patients that have rare conditions that require extremely novel therapeutics or very expensive therapeutics also have access, which is why we have two processes, the PMPRB review, as you know, and also the rare disease strategy that's under development. I'm going to continue this path, Mr. Speaker, to ensure that we can get to a place where people are not having to choose between paying rent and buying medication.
Shouldn't you table that strategy before applying the second part of that reform? which has been raised as an issue with everybody I mentioned. Did you know that?
Courte réponse, peut-être.
A short answer, please, Mr. Chair.
And
Pas de
the
réponse.
witness.
An answer, please. Saved by the bell. Okay.
Need to keep Canadians and indeed this committee abreast of the work that we're doing to lower the cost of drugs and ensure that people with rare diseases have access to life-saving medication.
Merci, Monsieur Thériault.
Thank you, Mr. Thériault.
Mr. Davies. Mr. Davies, go ahead. 2.5 minutes, please.
Thank you. Minister, many countries have employer-paid sick leave through statute in place prior to COVID-19. This includes countries like Finland, who has 9 days, Australia, 10 days, Iceland, 12 days, Norway, 16 days, Switzerland, 3 weeks, and Germany, 6 weeks. Minister, can you let us know if there are any plans with your government to amend the Canada Labour Code to match this international standard, say by legislating a mandatory 10-day paid sick leave for every Canadian worker under federal jurisdiction?
Well, thank you, Mr. Chair, and this gives me an opportunity to talk about some of my previous work as Canada's Labour Minister, updating the Canada Labour Code for the first time in 3 decades or more. And indeed, we included paid leave, paid personal leave, up to 5 days of leave, 3 days paid. And we'll continue that work, Mr. Speaker, working with employers, Mr. Chair, working with employers and unions to get to the right balance here in Canada. And I think the member is on the right track. This is not just a matter of money, it's about protecting people's jobs. So, of course, in the context of COVID-19, there's an important role for provinces to play in updating their provincial labor codes to protect people's jobs.
I'm sorry, the question was about your job. It's about the federal, you're a federal minister. I'm asking about the Canada Labour Code Minister. Dr. Tam, how long is a person infectious who has COVID-19?
It varies, but overall, in terms of the infectious period, if someone is infected, is usually within 10 days.
So if we have paid sick days of 3 days, that doesn't cover the period that a person is infectious with COVID-19, does it?
It depends on when the sick day starts, but certainly, I mean, it may take that long to recover, but that right. Also includes people who may be asymptomatic as well.
Right. Minister, the Liberal-appointed Hoskins Advisory Council called on your government to establish universal public pharmacare program for all Canadians no later than January 1, 2022. Will your government meet that deadline?
Well, first, I'll just respond to the previous question and note that we do have the Canada Recovery Benefit that is up to 4 weeks of income replacement, so that it does cover the length of time that someone could potentially be sick with COVID-19. I think it's important we have facts out there for Canadians so that Canadians are empowered to do the right thing if they feel unwell or if they have been diagnosed or are taking care of someone with COVID. In terms of the work on pharmacare, we have taken significant steps, more than any government in the past, to ensure that we have a national pharmacare program. We now have a Canada Drug Agency that's being stood up. We have an interim president. We have the interim president working on an essential medicines list. We'll continue to move forward with pharmacare with provinces and territories in collaboration. Thanks.
Thank you, Mr. Davies. So that brings round 3 to a close. We'll start round 4. We're running out of time, so I'm going to abbreviate round 4. We'll use 3-minute slots for the Liberals and Conservatives and 1.5-minute slots for the Bloc and the NDP. So
I think
next
we actually
up,
have enough time, though, right, for everyone to have their 5-minute round?
well, that would take us well past noon, and we still do have to have a vote on the estimates.
Why not 4 minutes and 2? I think we have enough time for that.
Sure, let's go with 4 minutes. So okay. 4 minutes and 2 minutes. Okay, go ahead, Mr. Barlow. 4 minutes.
I think it's actually me, Chair.
If it's you, go ahead. My information is Mr. Barlow, so go ahead.
Thank you. Mr. Stewart, just to confirm my colleague Mr. Barlow's question, the Known Traveller Digital Identity Project in Budget 2021, that's not being considered for use as a system for providing proof of COVID vaccination for Canadians traveled abroad.
Thank you for the question. It's a Transport Canada funding and a Transport Canada project, and therefore perhaps it would be appropriate to have officials from Transport Canada speak to its purposes. I myself don't know that.
Thank you. That's Thank you. Dr. Lucas, the Prime Minister recently said certificates of COVID vaccinations will be a reality for international travel. How we actually roll that out in alignment with partners and allies around the world is something that we are looking right now on how to coordinate. Dr. Lucas, is your department lead on these coordination efforts for Canada?
Mr. Chair, there are a number of federal departments and agencies involved in considering such work. I think it would be best, because of the link with the World Health Organization and their work, if I turn to Ian Stewart in terms of responding on the role within the health portfolio.
That's okay. I just was wondering if somebody could just briefly say who's lead on that within the representatives here.
Mr. Chair, as I'd indicated.
Okay. Maybe this, is there a task force that's been set up within the government to put this together?
I think it's easier to say that there are a number of departments involved, and the Public Health Agency is certainly involved because, of course.
Is there a lead person or minister on it?
I don't know whether that could be characterized that way. There's two components to the program. Certainly the Public Health Agency is leading the initial work being done around vaccination and borders.
Okay. Also, is there a system being built right now to provide Canadians traveling abroad with proof of COVID vaccination for participation in a project like this?
There are plans underway and there are projects in development to do what you're referring to, yes.
Have there been funds allocated for this?
Do you mean within my responsibility, have I allocated funds to support a project of that nature?
Are there funds allocated anywhere for a national system for proof of COVID vaccination for international travel?
Well, for the work that my agency is doing, we've appropriated funding internally to support that work. We have a representative, for instance, at the World Health Organization working on standards, Luc Gagnon.
What about a data management system? Have there been funds appropriated for the build out of something like that?
There is a project called Vaccine Connect, which is in the field with the provinces, which does provide a platform that would provide some of the infrastructure you're referring to. So
would you be using Vaccine or looking to use Vaccine Connect as a national system for proof of COVID vaccination for Canadians traveling abroad?
This is a technical question about what kind of certification is going to be required, and I'm not really a technical expert in that area, but Vaccine Connect is certainly an IT platform that could enable some of the data sharing that we're referring to here.
Is it being actively considered as a candidate for that purpose?
We are actively looking at how to support the development of a way to confirm vaccination at borders.
When will the public be aware of what the system requirements are, or when would that be available for use by the public?
This is a discussion among technical experts that isn't resolved yet, so I don't think that information could be made public the way you're referring to. I think it's a discussion.
What kind of a timeline are you working on right now, or has the government given you any timeline to work on?
Well, as you know, our plan is to see all Canadians vaccinated by September, and we're working in that regard. And so obviously that sets a timeline for the utility of this particular topic.
And by September, is that fully vaccinated?
It's, how are you defining fully vaccinated?
2 shots for every Canadian who needs it, or 1 shot of J&J.
It's the addressable public who wants to have a vaccine will be offered a vaccine sufficient.
Fully vaccinated.
Yeah, we're hoping by the end of September that all eligible Canadians who want to be vaccinated have had the offer of 2 doses. Yes, that is our intent.
You're on mute, Chair.
Oh, okay. Well, thank you, Ms. Rempel-Garner, and we'll go now to Ms. Sadu, 4 minutes.
Thank you, Mr. Chair. Thank you, Minister, to you and your team for appearing today. My questions to Dr. Tam. Dr. Tam, there's a false belief out there that the young adults and children do not need to worry about COVID. Tragically, a 13-year-old girl from Brampton passed away from the virus last week, and many of the individuals filling our hospitals are under the age of 40. What message would you like to send to Canadians about the threat posed by COVID-19 to young people?
Thank you for the question. And Chair, I just want to reiterate that COVID-19 can affect individuals of any age. However, serious outcomes are much more common in older age groups. But when there's a lot of cases, and the third wave is accelerating through the population, so we are seeing younger populations being affected. And in fact, one of the higher increases, what we're seeing, is actually the 40 to 49 year age group, as well as then follow the 60 to 69 year age group, as well as some, of course, even younger individuals. And that's what's actually impacting the ICU capacity at the moment in a number of the provinces. So I think the bottom line is that everyone needs to protect themselves using the individual protective measures, and also get the vaccine as soon as you're eligible for it.
Thank you. Next question to Mr. Stewart. Just to clarify, earlier you spoke on the number of people tested positive at the border, and I wanted to confirm that the number was at arrival and not after 3 days.
Thank you for the follow-up question, Mr. Chair. The number I provided was specifically in response to a question about the day 8 test. It was not a question of the total testing and the total numbers of people tested. And so just to clarify in that regard, we've tested about 369,000 people if you include the day 1 test and the day 10 test in Canada. And then, of course, everybody was tested external to Canada before they even arrived at the gate. Thank you for your question.
Thank you for the clarification. And next questions to Minister. Minister, as you know, Brampton is a hotspot zone for COVID-19. The region is home so many essential workers who live in multi-generation homes, and with a positivity rate of 22%. Peel needs support. Unfortunately, the province did not direct sufficient resources to Peel early enough. Minister, what support the federal government has already provided directly to Peel?
Well, thank you very much. And, listen, I'll repeat that managing COVID in communities is a lot of work at every level of government and community. And so it's been a pleasure to work with Dr. Lowe, I have to say, to meet with Dr. Lowe and his team early on in the pandemic, and then to regularly connect with him to understand how we can best support Peel and the Brampton region has been really critically important and has informed us. And so, as you know, we've provided many supports to Peel, including on-ground support and long-term care facilities in the tragic first wave, public health outbreak response from the Public Health Agency of Canada, a voluntary isolation site for Peel region. And this is in addition to the 300 federal contact tracers who are performing 2,500 to 3,000 calls a day in Ontario, additional voluntary isolation sites across the province, 11 million rapid tests and support to deploy those rapid tests in workplaces, and of course the $5 billion to Ontario through Safe Restart. I'll continue to work with Dr. Lowe, MP, you have my word, and I want to congratulate him on taking strong measures to protect workers in workplaces. I do believe that's going to really help Peel region and protect those vulnerable workers.
Thank you, Ms. Sadhu. We go now to, I believe it's, I'm not sure who was it, Mr. Barlow? With the.
I'm not sure if John wants to go, but I'll go very quickly for out of time.
Okay, Ms. Rumpelgarner, and if you can try to shorten it up, we are really hamstrung for time.
I will. Perhaps I will direct this to Mr. Stewart. So Major General Fortin said that we don't have a line of sight on the AstraZeneca vaccine deliveries for coming months. In France, there has been a recommendation made for persons who have received the first shot of the AstraZeneca vaccine, but now aren't eligible for it given other risk concerns, to be given a dose of an mRNA vaccine or another vaccine. Is Health Canada actively looking at providing similar advice to such persons?
Deputy Lucas would be better placed to speak about Health Canada advice. Danny was accurate in saying that we do not currently know plans for AstraZeneca deliveries on a specific date, which was your question, but we do in fact have AstraZeneca forthcoming, and we have several sources of supply in that regard. And myself, I had a first dose of AstraZeneca, and I have every comfort that I'll get my second dose in due course. There are studies internationally looking at mixing doses. And it seems like that's an area of science that might be promising, but that's for Dr. Tam is a far better person to speak to this mix and match that's being investigated in Europe than myself.
I would just ask, is anybody providing advice, or is there likely going to be a recommendation forthcoming in this regard?
Perhaps I can ask Teresa then to speak to your question, ma'am.
Yes, the clinical trials are ongoing. So the regulator, Health Canada, as well as the National Advisory Committee on Immunization will be looking at that very question.
And when will that recommendation, when is that advice likely to come out?
In some of the international clinical trials, some of them will be available in the next weeks. But what we're looking at is that with the AstraZeneca vaccine, the vaccine actually performs better at 12-week at least in terms of the interval. So we expect to have some of these answers prior to individuals needing their second dose.
There currently, through Health Canada advice, are there currently any persons who may have received one dose of AstraZeneca so far that would not be eligible, or has Health Canada said anybody can have a dose of AstraZeneca at this point and rescinded the previous advice for certain age groups?
Mr. Chair, from a Health Canada regulatory perspective, the vaccine has been approved for people 18 and up. That's what creates the legal framework for its use. The only contraindication is people who had a vaccine-induced thrombotic event with thrombocytopenia associated with their first dose are not recommended to use it for their second dose. Beyond that, as Dr. Tam has noted, the guidance on the optimal use of the vaccine is provided by the National Advisory Committee on Immunization.
Thank you, Chair.
Thank you, Ms. Rempel-Garner. We'll go now to Mr. Van Bynen. Mr. Van Bynen, please go ahead. You have 4 minutes, but if you're able to shorten it up, it would be very helpful.
Okay, as vaccines become more widely available across the country, I'm so proud to see so many Canadians step up and get vaccinated. And even though we should all have full confidence in the vaccine approved for use in Canada are safe and effective, we also know that some Canadians still have some vaccination hesitation. It's disappointing to see so many gotcha type questions today, and we need to focus on better understanding the critical situation and work together to add value to the dialogue. So it's not helpful to hear or to see repeated in social media spurious conjecture about vaccinations that are not based in fact. What is this government doing to combat vaccine hesitance? And what would you say to any Canadians who are listening who aren't certain about getting the vaccine when it's their turn?
Excuse me, Mr. Van Bynen, if you could turn your camera on, it's helpful for the interpreters to be able to see you speak.
I'm sorry, do I need to repeat this then? I think you've heard the question.
I probably can answer, Mr. Chair, unless it's needed for translation.
Sorry. Your mute is on, Mr. Chair.
No need to repeat the question. This is the interpreter.
Okay,
sorry,
thank you.
Yes, go ahead. Mr. Van Bynen, please repeat the question, and so that the interpreters can.
There's no need to repeat the question.
The interpreter said that they didn't need to repeat the question.
Okay.
Oh, I apologize. In that case, we'll go straight to the answer. Please go ahead, Ms.
Thank you.
Well, thank you. And I wanted to start and then turn to President Stewart to talk about some of the exciting work we're doing in this area. But I will just start by agreeing with the member that it's really important, especially as elected officials, that we're not in any way presenting either knowingly or unknowingly misinformation to Canadians, because they're counting on us. They're counting on us to be presenting them with accurate information, with the right connections to the right resources. Government websites are always a safe place to find information out about the current research and science. Certainly, healthcare providers are another good choice. Pharmacists are always available to talk through the pros and cons of vaccination and answer any questions. And by the way, it's perfectly normal for Canadians to have questions. These are new vaccines, and some people are anxious. Other people are very excited to get vaccinated. And as we've seen around the country with lineups and folks very excited to take the vaccine when it's their turn. But nonetheless, I do think, to your point, MP, we have a obligation as visible leaders in our community to ensure we're not pushing misinformation in any way. And I know that all of us want our communities to get back to normal, and that relies on people accepting vaccination when it's their turn and having the confidence to do that. It's very critically important to our economy that people are vaccinated, and to, of course, the safety of Canadians, the saving lives and stopping the spread. That's the goal of this vaccination campaign. So I will just say it's exciting because we have a special fund that we'll be announcing very soon to work with cultural communities, with underrepresented communities, to ensure that they get information in culturally appropriate ways, in language appropriate ways, in communities through educators that are sometimes health educators, other times community educators. And that's very exciting. $53 million, although I understand that this is where I need Ian Stewart's wisdom. I understand we've increased the amount of funding available for that stream of funding because of the exciting uptake. And listen, what's great news is that there are so many Canadian organizations and stakeholders wanting to do this work with us. And so maybe President Stewart, you can talk about the envelope of funding available, and that will be announced very soon.
Well, thank you for that, Minister. There are two things that add up to the initiatives that Minister Hajdu is referring to. One is around building collaborative partnerships with the science centers and other social and scientific infrastructure to get them engaged in telling Canadians about immunization opportunities. And then, as Minister Hajdu was also saying, there's the Vaccine Community Innovation Challenge program, which we're very excited about. As Minister Hajdu said, it's an open process. It invites community leaders from all different kinds of communities, and we've had response from every province and territory in Canada, Indigenous communities, linguistic groups, cultural groups that come forward and talk about how they're going to immunize or encourage immunization in their community and overcome vaccine hesitancy in their community. So as Minister Hajdu said, we've increased support to that challenge program because the response has been so strong, and people are interested in making sure that the people they know and the leaders in the communities marshal their community to go out and get immunized. So thanks for the opportunity to mention that.
Thank you, Mr. Van Bynen. Nous allons maintenant à Monsieur.
We now go to Mr. Thériault. Mr. Thériault, go ahead, 2 minutes. Thank you, Mr. Chair. Minister, before the first wave, due to chronic underfunding of health networks were already under strain, and with the pandemic, there are collateral effects, and the longer time goes on, the more effects there are on non-COVID patients. People have told us in Quebec, I'm speaking of the associations who've told us, that there are 94,000 patients who have gone beyond the wait lists there should have been, and the death rate goes up by 8 to 10%. There have been agreements. You've talked about your $19 billion for COVID patients, but why is there a political choice being made to not inject funds now to allow healthcare systems to take care of non-COVID patients and also to deal with patients, or rather human resources, who are ill and who've decided to do other things in life? We'll have people who have expertise who are lost, who have died because you've made a poor political choice. All experts have said that it's not justified medically or economically. Why?
Well, Mr. Chair, I think, again, misinformation. We have injected billions of dollars into Quebec and indeed all provinces and territories, and will continue to be there for the provinces and territories, including Quebec.
J'ai pas dit, Madame la Ministre.
Minister, I didn't say that you hadn't injected money. I said you injected money with agreements with the provinces strictly to deal with COVID. You haven't added anything for health transfers. You're the one who's presenting misinformation, not me.
Merci, Monsieur Thériault. The witness.
Thank you, Mr. Thériault.
I'll just repeat myself. We've been there for provinces and territories with billions of dollars for specialized streams of healthcare and indeed generally through COVID-19. As the Prime Minister has said, we'll continue to be there for Quebec and Quebecers. But right now we stay solely focused on getting Canadians through COVID-19. And that's what we'll do with all Canadians, including Quebecers.
Thank you, Mr. Thériault. We'll go now to Mr. Davies. Mr. Davies, go ahead, 2 minutes.
Thank you. Mr. Stewart, have any of the 297 people who have paid a $3,000 fine for failing to stay in a quarantine hotel tested positive for COVID-19?
I'm not aware of the medical histories of all of those people, sir.
Is it possible for you to get that information and supply it to the committee?
We can investigate whether people who, but I think, to be honest, that's patient history and probably not for us to be providing, but we'll explore what we can do in this space, sir.
Okay, thank you. Minister, when Doug Ford announced Ontario's stay-at-home order on April 7th, he said the province's crisis had become worse than predicted, but modeling presented 2 months earlier clearly signaled the trouble to come. Experts have noted that the Ford government's failure to act quickly and decisively on dire warnings has exacerbated the crisis and ultimately cost lives. We know recently that the Canadian Armed Forces have been sent in now for the second time into Ontario. Minister, do you believe that the third wave of COVID-19 has exceeded the Ford government's capacity to respond effectively?
Mr. Chair, what I'll say is that we have committed to Ontarians like we have to Quebecers, like we have to British Columbians, and every Canadian that will be there no matter what COVID-19 throws at us. I think it's also an important reminder to all of us that we need to let science and evidence lead. We have incredible scientists, public health experts, and researchers volunteering time at a variety of different expert panels and on a variety of different tables, including Ontario's science table. It's very important that all of us commit together that we will respect the expertise of the leaders that are guiding us through this.
Thank you, Mr. Davies. So, committee, that brings our questioning to a close. I would like to thank the witnesses and the minister, of course, and I'd like to thank you all and all of your staff for your 24/7 dedication and commitment to protecting the safety and well-being of Canadians. So we do have one more, some voting to carry on. So if you wish, you may certainly withdraw. To the committee, we have something like 11 votes to do. I'm wondering if we are able to do them in one fell swoop. That would require. Okay, it will require an unanimous consent to conduct it in this way. Do we have unanimous consent to do it in one fell swoop?
Yes.
Yes, we do. Okay.
Yes.
Are we all in favor? On division?
On division.
Okay, on division. So thank you all. The estimates are passed on division. So thank you, committee, to all of you for your great questions today and your and again, thank you to the minister and all of the witnesses for all that you do all the time. So thanks a lot. And with that, we are adjourned.
Have a good weekend, everyone. A great weekend.